And first of all, I would like to thank you for giving us opportunity to make interview with you, because you are so well-known urologist, and you do a lot of for urology in the world, in the Europe, and to increase the urological level for urologists, and to provide all this help to young urologists, and to so we'd like to talk about educational possibilities that EU gives to its members, and even there are some possibilities for non-members. How is it differ?
You're really too kind, and it's my pleasure to have this interview with you here in this remote Japan, far from home. And it's my pleasure. I have been the director of the European School of Urology for many years, for 8 years, and I've now become the Adjunct Secretary General of the EAU, responsible for education, and so I can give you some inside information on the possibilities we have. We organize a lot of educational events, and one of the most important, let's say, the flagship of the EAU, of the education of the EAU, is the UREP course. It's the European Urology Residence Educational Program. We offer this for free. It's paid. It's completely sponsored by EAU for the EAU last year's residents in training. And this means for European standards following the European Board of Urology, it's mostly, depending on the country, 5 or 6 years. And this is, of course, offered also to the Russian pupils, let's say the students. One of the problems is that the education in urology in Russia only takes 2 years, and that most of them that then continue for a PhD degree, they are, let us say, after 2 years of general education in urology and 2 years of PhD, they arrive at the level of the other European colleagues. And this is what we would prefer to have at the UREP course. Because you might understand that after 2 years of education, there's maybe too much information given at the UREP, which is too complicated, which is too far already. So we will be pleased to have applications from people that have at least had 5 years of training. That would be profitable. And then also the money that the EAU is spending to have them there is well spent and not lost, let's say, to people that are too young.
And aim of, for example, you provide the whole accommodation for the students, and it's interesting to know why do you do this? Why do you pay such a lot of money for educating? Like, in our world, it's going to be when you educate somebody, it grows, and probably it's going to be competition between urologists, concurrence, and all this stuff. Why do you do this? Why do they provide all this?
We are actually, EAU is taking care of the scientific level of urology throughout Europe, and we want to something like a standard level that we want everybody to reach. And why at the end of the training we organize this? It's to really lift people that were a little bit behind to the level of the better performers, you see. There's certainly a different level from people coming from the former Russian Federation. There is different levels throughout Europe, also between Germans and Dutch people. The level of education is not the same. And with the course, we want to really give an overview of the entire scope of urology. It's on female urology, on incontinence, it's on oncology, it's on pediatric. So we cover the entire field of urology, where we want everybody at the end of their training getting at the same level.
And get the FIBU exam?
Yeah, getting the FIBU exam it's an interesting issue, because we have organized since years the European Board of Urology, the written part of the examination after the course. But you must know that the EBU, the European Board of Urology, and the EAU, it's not the same.
Yes,
for instance, I would be a teacher at UREP course. I do not know the questions of the EBU. So it's not because you have followed the UREP course that automatically you would do a fantastic exam because it's independent from each other. But of course, you will never be better trained in urology than after the Europe course, because you just get it freshly in 5 days, the entire scope taught and delivered to you. So you will never be better prepared to the exam than after the Europe course. What's going to be in the future is not sure yet, whether we continue to do this in Prague after the Europe course, or whether it will be done online within the days after the Europe. This is on the decision of the EBU, not of EAU, because it's an EBU exam.
And interesting to know, for example, I went to EBU site and I found a lot of information, but I could not find who the head of EBU, who the chief of EBU. It's only staff that's working for a question, and who prepare questions, who do the certification and exams.
Well, it's not up to me to say how the EBU functions, but the EBU has a president who actually is Professor Montanari from Milan. The next will be Professor Metecek from Turkey. But the EBU is working with a lot of subcommittees. There's the examination committee, there's the accreditation committee that recognizes centers in Europe for education. So there's the manpower committee, with each time a board of international people from many countries, and with the chairman again, who have to report to the EBU top and the executive committee. So
and every year the questions are changing.
The exam in the examination committee, they look at the questions, and actually, let's say there is an exam of 100 questions that are validated, and on top of that, there's a number of questions that are not yet validated, that the EBU examination committee has to look after whether these questions are valid or not, whether there is enough correct answers, whether the questions are not duplicating, and so on and so on. So when a student is taking the exam, he's doing some real questions and he's doing some questions that are just tested. But you cannot know as a student which they are. But they do the analysis, and so every time there will be new questions every year.
And is the EU interested in making FIBU exam obligatory for all European residents?
You cannot impose this. Certainly EAU cannot do this. The UEMS is the Union Européenne des Médecins Spécialistes. They are about cardiology, they are about urology, and in urology it's the EBU is the urology branch of the UEMS. And they would like, of course, to impose this to everybody so that the standard would be raised to a certain level where someone from Greece who has the EBU exam could tomorrow go and work in Russia without any problem when he speaks the language, or someone from Romania could come to Belgium. But this is not the case yet, because it's not obligatory. You cannot oblige the people to take the exam and to get the level. But the more people take it, the more it will be taken into account for. If you apply to go and perform urology in France, it might be that they ask, did you do the FIBU exam? And if you didn't do it, okay, then they will say you are not proven at a good level. But it cannot be used yet, but in the future this will continue to expand. And the more people take the exam, the more the value will be valued.
Because, for example, Professor Marberger told me yesterday, and if somebody will come without FIBU exams, it's very difficult to get a job. In some countries, it's practically obligatory. It's not written by law, but it's when you come to work, they ask for the FIBU exam. There
are indeed a number of countries where you, when you finish your training, your exit exam is the FIBU. So they have to take the exam. I think in Poland, for instance, they have to take the exam before they can start working as urologists. So. But it's not in most countries, it's not the case yet.
Okay. And can you tell us about European School of Urology? What is, as far as I understand, it's part of EAU and also part of educational part of EAU.
Well, the European School of Urology is actually the education office of the EAU. And they take on a lot of educational activities, and the Europe course is one of the first. We have already explained that. The European School of Urology is also organizing ESU courses, teaching courses and events at the occasion of the national congresses. Mm-hmm. So when, for instance, there is in Romania, they have the national congress, they can ask the ESU whether we are willing to come and give a course on a topic that they want. They say, we want to have an update on urolithiasis. Mm-hmm. And then the ESU will decide, okay, for Romania, we will have this and that professor that will be sent to Bucharest, for instance, to go and teach during what you want, 3-4 hours, a course on these topics, where we then also at the end of the course involve the local people, the local urologists, to do case discussions together with the panel of the international experts. And EAU then covers the travel and the hotel and the stay from the faculty that we send there. But this is always on the request of the national society. So if there is a national congress in Moscow, or it's organized in Novosibirsk or in Ekaterinburg, the national congress, and they apply for an ESU course, we will be glad to go there and to come and teach on what topic you ever like.
I think it has been some such schools in Russian already during the Russian national meeting.
Yeah, sure. I remember a couple of years ago I went there with Professor De Bruyne and Professor Nordling, and we met Professor Lopatkin at that time, and I think there were 600-700 urologists attending, and we had a morning session of 3 or 4 hours of ESU course, where everybody, of course, is most welcome.
Yeah, and can you tell us about the scholarship programs?
The scholarship program is another, let's say, another office in education in the EAU. This is actually meant for EAU members. You need to be an EAU member, but an EAU membership for a junior member, I think it's 50 euros. It's no more than that. And then you can apply and say, I would like to go for a short stay or for a longer stay or even for a fellowship to do research in this or that eminent place wherever in Europe that is recognized by EAU, sometimes also by EAU, to be a good training center. So I could imagine that a young Russian colleague who has done this, who took the Europe course, has seen a couple of experts. He says, I want to go to Paris to Professor Chartier-Kastler to see how they do the female urology, how they do the incontinence surgery, because this is my field of interest. Okay, then he has to apply to the European Urology Scholarship Program, and he says, I want to go there for 6 weeks or for 3 months. And then it goes to the committee, to the board of the USP, and they say, okay, this is a good idea. This will be profitable for the Russian young guy, and it will be profitable to his institute when he could have this. And then when they agree, he will be funded to travel and go there. He will be funded to stay in Paris and be paid for his hotel stay. And he will even get some pocket money so that he can enjoy something in the evening. So, and this is on an individual basis decided by the board of the European Urology Scholarship Program, where there is funding from the EAU provided for these occasions.
And what are the conditions the urologist should meet to get in scholarship? Okay,
he must be well trained. This means he must be a young urologist. He may be even a last year resident, but we prefer to have young urologists who want some super specialization. They need to speak fluently English because all the education sites in Europe, whether this is in France or in Belgium or in the Netherlands, mostly English is the language that EAU promotes so that everybody could understand each other. And so if you just speak Russian, probably you will not be allowed to go there because your interaction will be insufficient to make your visit profitable to you.
Is it recommended to go to EBU certified centers or wherever you choose?
There are a number of EBU certified centers. This means they have a general EBU accreditation. There are, I think, more than 50 centers throughout Europe. And again, it's not obligatory. So this means that there are many centers that are very good that did not ask for an EBU accreditation.
And can you tell in general, how many scholarships do you give 1 year, for example? To get some numbers.
I think that last year there have been more than 50 scholarship programs funded by the EAU.
50 scholarships from different countries from Europe.
Yeah, but you know, it's mostly. I see that in my own place, I have people from inside Europe, coming from former Eastern Europe, coming from the former USSR, coming from the Baltic states, coming from also from the United Kingdom. They come sometimes just for a procedure. They want to see radical prostatectomies in an open way, or they want to see robot, or they want to see ureteroinoscopy. They can come for a very specific to watch surgery or to do andrology, for instance. So there are many possibilities. It's just on the wish of the candidate.
And you said that 15 scholarships were given, and how many candidates did you have?
I think they did about not refuse anyone, because they have sufficient funding from the EAU to pay, but there is of course a limit. But we will try to fulfill all the decent requests. When it's a good request, we will do what we can to fund it.
Okay, but they sponsoring, because it's for Russian people, it's a little bit strange. Why do you spend give them such a lot of money? For us, it's quite a big amount of money. Why do you give it to them? How is it sponsored? It was sponsored only by EAU?
Yeah, it's only by the EAU, and it's simply, again, because EAU wants to raise the level of urology in general, not only for the patients in Germany and France, but also in Russia. And so we need to raise the level of education, and that's why we are willing to support this financially.
And do you check if, for example, someone applies for scholarship and he wants to go somewhere, and do you check if he has it's not obligatory for him to go there because he had enough education at home? Do you check this, or anyway?
Yeah, this will be checked, because he needs to get his CV. He needs to be supported by one or two seniors who say this is a good fellow. Also concerning the funding, there will be a contact with the host, and they will be said, okay, this is what he will need to travel, this is what he will need to stay, because I can imagine that someone who is living in Rostov-on-Don and he comes to Paris, he doesn't know what he will have to pay. So this is just in accordance with the host, who then says, this is the budget that will be provided. He signs it, it goes back to the EUSP, and then they agree on it.
And do students who takes a scholarship, do they have to write a report after it, or what they should do after?
They have to read a report that goes to the EUSP, so that the EUSP has feedback also on the center, whether the center is doing well and whether it was profitable to the student. These are the two issues. On the other hand, if someone has been somewhere, he can take profit and say, oh, I found this was so interesting, and he can make a report that he then sends to the European Urology Today, and he can say, okay, I was there, and he can have a photograph with his mentor and when he was doing surgery to say, okay, this is how this went. So it's profitable that way, that he gets visibility through the European Urology Today as well.
And for the mentors, is it interesting for them to get people for scholarship?
I think that everybody cannot accommodate, I would say, 5 or 6 people at the same time. What I try to do myself is just to have one. Mm-hmm. Because if you have 2, already your residents are in competition to scrub and to be active in theater. So if you have 2 visitors at the same time, the chance that they will really be very close to the activities is smaller. And so we want to really integrate them. And it's in the most of the training sites, this is how they want to have the fellows. Not 5, 6 fellows that watch the same operation. I think that it's not interesting.
And so, as far as I know, there are a few types of scholarships. It's going to be a short-term visit, a clinical visit, and research.
Yeah, it's often observerships. They go there. and they are integrated in the department as good as they are. If they are very interactive, they will, of course, be more integrated. The fellowships, that is a different issue, because for a fellowship you need to have a research program. And a research program you cannot do in 6 weeks or in 3 months. So these are made for people that want to go to London, to the Institute of Urology, to do a fellowship on ureteroscopy or research on lithiasis, go in the lab. So then you need to submit the program on what you're going to do. I'm going to work that many months in the lab. I will write a PhD or whatever. So this is really meant for excellent people with future academic aspirations and ambitions.
Is it possible to get, for example, 1 or 2 scholarships, or just 1 scholarship for the member?
A scholarship, this means you go this year, you go for 6 weeks to Paris, and next year you apply again to go for 6 weeks to another place. This is possible when it's interesting, when it seems not doing the same thing, or not just, it's not, we are not a bureau of tourism, you know.
Yeah, of course. Yeah, of course.
We really want that the money that we spend is meant, it's meant for education, and it should be used for education, not to go and visit fancy places.
Yeah, of course, it's not the aim of you. And can you tell a few words about Welcome Masterclass and other masterclasses that Prince School of Urology provide?
We have a number of masterclasses. The first is the masterclass that you just meant is the Weill Cornell ESU masterclass. This is a very special event that again is completely sponsored by the EAU, together with the US faculty from Weill Cornell University. It dates back from the after-war period, when in Austria there was the Austrian Foundation, who was taking selected people to come there and get trained, because there was a lack of training facilities in the former Eastern Europe. And from that, the US have continued to do that, but have integrated the European School of Urology. So now we are a divided European and American faculty that stay in, it's not a hotel, it's in a castle, where we are 1 week with 40 young, very ambitious future academic people, most of the time again from former Eastern Europe. There's also people from Western Europe that apply for it, but that's a minority. So mostly it's people from Ukraine, from Uzbekistan, from Armenia, and so on that apply. And again, they need to prove that they can speak English. They need to have a publication to show really that this is the future academia, the future leaders in their country. And they are selected very thoroughly, together with Soros helps us in selecting them. They need to have application endorsement so that we know that this is money, again, that is well spent. They stayed in for 1 week, and we have now designed with the European School of Urology and our American friends a curriculum where in 3 years the entire scope of urology is covered. So there will be 1 year it's on renal cell carcinoma, on infertility and incontinence. Next year it's on prostate cancer, and so on and so on. And during this week you are living together as a student with eminent professors from New York, from the US, and you're eating with them, you're drinking coffee, you're having a beer in the evening together. There is also a music evening, a concert, because Salzburg is of course known because of Mozart as being one of the most beautiful cities on music. And it's the interaction with the faculty and the pupils. You cannot believe how important that is, because the people that I've seen there through the years, you see them always back later on international congresses. This is people that really are taking the lead in their country. They have interaction with the European School also afterwards. It's a very, very interesting opportunity. But you need to be high profile, speak English, have a publication, and really be well trained.
And you said that 40 people, and how many applications do you have for this?
We mostly have, we get from Soros sometimes 100 applications, from which we select the best ones. You should not be too old. You need to be urologist. Sometimes there is other non-urologists who are applying, and so there's the different. If you have already been twice, we're going to take new ones instead of taking the same. And so there's a number of criteria that we apply to select.
And what about other master classes that?
We have actually, I would say this is a special master class for the better people. Then there is master classes that we organize in specific topics of urology that we feel are a little bit at the edge of urology and that maybe urology might even lose in the future to other specialties. An example is the andrology. Mm-hmm. Andrology might be lost to internal medicine, to andrologists, and so we have now organized a master class on andrology. We have organized a master class on female functional urology and on incontinence, because again, this is something where we feel that urologists should be more involved, because otherwise we fear to lose the field to our colleague gynecologists. We have a master class. We had a master class on medical oncology, medical oncological treatment, because this is going to be lost to medical oncologists. And so we want people to be specially interested in this, and so we want to attract to these different master classes people for a further education.
Is it a separate event or it's during other events?
It's both. We have the andrology, for instance, is linked to a big andrology session in I think it's in Germany this year. But for instance, the female functional and reconstructive urology masterclass is separate. It's separately organized. So it's not linked to another meeting.
Okay. And for Russian people, it's a little bit difficult to come to the meetings because of the distance, of the price, of the language, and so. And now there is on EAU there are online courses that are very popular in Russia because you can stay at home and look at it. Mm-hmm. And what do you think of the future of this education, of online education?
Yeah, online education is. It's a nice word, and it's very useful, of course, but it's very difficult to make online education because medicine is changing so rapidly. It's very difficult to really give state-of-the-art presentations online, but we are expanding with the European School of Urology to have more and more educational courses that are approved and recognized by everybody as being state-of-the-art. It's always difficult for a surgeon not to give expert opinion. And what we actually want in educational courses everywhere, what we want on education online as well, is the guidelines. It's application of the guidelines of the EAU, which should be the basis. And when we are teaching other things, expert opinions, which is not in accordance with the guideline, we should specify that this is not guideline, but expert opinion. You can add it, but and that for education online is very important, that this should really be filtered and checked for that this is really what is in accordance with the guidelines.
Do you think it's going to grow this part it's going to take more people to go online education?
I'm sure when you look at the evolution in the US, many people are taking education online. They need to do it to get accredited, and they have to get a number of accreditation points per year. And the education online is the cheapest and the fastest way of getting this education. So we will continue to expand and have more and more courses online.
I think it's really interesting for Russia because it's quite difficult for us to come to the conference.
Yeah.
And
we understand that's a problem.
And also, do you think about for example, the webcasting of the conference is going to be bigger or more interesting in the future?
There is more and more request, also, for instance, from the residents, the ESRU, the former ESRU, where the residents are sitting together, and they want all these courses to be webcasted. And this is more and more applied. And all the ESU courses that we give at the at the EAU Congress, the yearly EAU Congress was in Paris, next year is in Milan. All the courses that we give there, and it's about 40 courses, are webcasted, and everybody can have access to them through the net.
The thing is that I'm also a member of YESRU, that is what we were discussing in Prague about the webcasting of our resident day.
Yep.
So I think it can attach more and more residents to it. Because, for example, in Russia, residents, as you said, only 2 years of residency, they even can't find out possibilities. They even don't know there exists resident day during the meeting, and it's always brilliant lectures and very interesting, especially for residents. So we want to make some webcasting about it, because before it was no webcasting of the resident day.
But I've seen that you have just recently requested EAU whether the ESRU session could be webcasted, and we have agreed to take care of that.
Probably you can say anything to Russian urologists, some advices or some wishes to Russians.
Of course I can say something to them. They should get more implied in the EAU activities, and they should really go to the internet and see what is available for them and take profit of it, because it's all there. We try to pay and to sponsor what we can. I think the internet facilities will be increased and implemented, so I hope that we will have more and more activities taken by all the Russian colleagues and friends.